Welcome, everyone. We are so pleased to be hosting today's discussion on AI and global health, what it means in practice, and why it matters now. I'm Sarah Anderson, Executive Director of the Bay Area Global Health Alliance, and thank you all so much for being here. For those of you who are new to the Alliance, we are a global cross-sector membership network with more than 100 organizations. We bridge technology, industry, finance, and traditional global health. Today, only about a quarter of our members are based in the Bay Area, although we still continue to embrace our Bay Area roots and the region's innovation ethos. Roughly about 40% of our members are focused on technology and digital health. And the Alliance was founded really on a very simple idea that no one sector or organization or company can solve the complex global health challenges alone. We need to do it together. And in this period of rapid change and uncertainty, trusted communities matter more than ever before. We see ourselves as a connector, a neutral convener, and sense maker, creating space for people who don't always sit at the same table. And we want to connect, learn from each other, and move ideas forward together. We explore AI applications in global health, and we've had since 2023 a series on AI and global health. We also look at the changing financing and policy landscape that's kind of in the new future of the field of global health. On housekeeping, a few quick notes before we begin. Please make sure you stay muted, but please use the chat throughout the session for questions and connections. We purposely make all of our virtual convenings as Zoom meetings and not webinars so that people can chat with each other, introduce each other, and form a community, even though it's virtual. We've reserved some time for audience Q&A, so please make sure that you put your questions in the chat and we'll be monitoring those. This meeting is being recorded and we'll share an insights report afterwards. And while this session isn't held under Chatham House rules, one thing we value deeply at the Alliance is creating that space for candid, practical conversations across the sectors, particularly on issues that are evolving as quickly as AI and governance. We hope today's discussion can contribute to the spirit of that openness and shared learning. Now to the conversation today. It comes at a very important moment. AI is increasingly being positioned as an efficiency multiplier in a highly constrained environment. We're helping to address workforce shortages, strengthening surveillance systems, improving diagnostics, and optimizing health systems. But alongside that momentum is the growing recognition that governance, not technology alone, will determine whether these tools actually deliver value, scale responsibly, and improve equity. And when we say governance, we're not talking about something abstract or purely regulatory. We're talking about very practical questions. Who owns and controls health data? Are systems interoperable? How are procurement and deployment decisions made? Who is accountable when systems fail or cause harm? And how do countries ensure these technologies align with local priorities, not just external market incentives? Many of these same themes emerged in another alliance convening that we had last week on country-led innovation ecosystems, particularly the idea that sustainable innovation depends on strengthening existing systems, local ownership, and long-term capacity? And these questions are becoming more urgent as the broader global health landscape shifts. Countries, particularly low and middle income countries, are asserting greater ownership over data, systems, and priorities, even as financial constraints force organizations to think differently about efficiency, scale, and sustainability. AI is increasingly entering that conversation, but governance will determine whether it strengthens systems or deepens fragmentation. We at the Alliance are especially fortunate that the work of several Alliance member organizations, those who are on this call today and as our speakers, sit directly at the center of these issues. HealthAI has been highlighting that governance capacity is increasingly being the primary bottleneck to scaling AI responsibly in health systems. Transform Health has been pushing the field to move from broad principles to actual implementation, particularly around data governance, rights, and country ownership. And Vital Strategies has been emphasizing that AI readiness is ultimately system readiness. Without digital infrastructure, workforce capacity, financing, and institutional trust, AI simply does not scale sustainably. And this conversation is especially timely because in just a couple of weeks, many of these same issues will be front and center at the World Health Assembly, particularly around digital health, governance, and accountability. So today is really about making this practical. What does governance actually mean when selecting a digital tool, entering a partnership, or working with the ministries of health? And how do organizations move from high-level principles to real operational decisions? Our hope is that by the end of today's session, you will leave with a clearer understanding of what AI governance actually means and why governance is increasingly becoming the bottleneck, not the technology itself. We hope you'll have concrete examples of how these issues are showing up in real world decisions and trade offs. And we hope you will also have a few practical questions to guide your decisions around AI tools, partnerships, and strategy moving forward. We are incredibly fortunate to have such thoughtful and experienced speakers with us today, and we're grateful for their leadership in helping shape this conversation. So with that, let me turn this over to my co-moderator, Daniel Messer, FHI 360's Chief Digital and IT Transformation Officer. Daniel, over to you.
Thank you, Sarah. Can you hear me okay? All
Yes.
right. Yeah, good morning, evening. I looked at the chat and this is exciting. We have folks from all over the world here today, all time zones, including Indonesia, Senegal. So that's very exciting. So yeah, as Sarah said, I'm the Chief Digital and IT Transformation Officer here at FHI 360. Based in Durham and DC in the United States. And I work in the area of digital since 25 years now. It's almost a little embarrassing, but I can say I have never seen such rapid changes as we see at the moment with AI. So, and that's why we thought the topic of governance is actually something we should look a little bit into more. And what does it actually mean for sort of all this rapid development? So here at FHI 360, AI is now part of our global strategy. And of course, for Chief Digital Officer, that's that's very good. I was very happy to see that we took it so serious. But it is moving at such a fast pace, and I've never seen that kind of rapid change before, where you come up with guidelines and they're already out of date, and it's like the next day, yeah? And so we operate sort of in global health, humanitarian response, and development. And often we operate at the intersection of technology, data, policies, community level, and impact. So, and at FHI, at least, as you all probably have, we have very complex regulatory environments with vulnerable populations, with partners who expect us both to be innovative and rigor. And what does that mean for governance? Yeah. So, and at least from my experience at FHI 360, we are working with various tech partners, and governance is like uh, is the idea, the intention idea is to protect people, data, trust, and while we're still enabling this innovation, we don't want to be the ones who restrict. We want to be seen as an enabler. And today's session is about how governance can be an enabler and not a barrier. So with that, I'm going to introduce quickly the speakers we have today. We have Dr. Peeling Yap from is at HealthAI, the chief scientist there. We have Mathilde Forslund, who is the CEO of Transform Health. And we have Pedro do Carmo Baumgras de Paula, who is the Senior Vice President at Global Innovation. So we gonna do like short sessions, and then we go towards the some of the questions that Sarah said. But Peeling, she will ground us sort of in what governance actually includes. So, and Mathilde will then talk about who owns and controls it, and then we switch over to Pedro, who will show sort of what happens when the systems aren't ready. So let me start with Pei-Ling. Let me start with you. And first, I want to congratulate you to your recent appointment as co-editor in chief of the Artificial Intelligence in Global Health, which is a new journal from the Royal Society of Tropical Medicine and Hygiene, and it's coming out next month. So stay tuned about that. So, Pei-Ling, if I can switch over to you, you have been looking at globally at how countries are governing AI in health. At a very practical level, what does AI governance actually include, and where are you seeing the biggest gaps today? If I can switch over to you.
Thanks a lot, Daniel, and thank you so much for the shout out. I definitely encourage the audience on this call to keep a lookout for the launch of the new journal by the Royal Society. Now, back to your question, Daniel. What do we mean when we say AI governance in health? Right? What does it actually include? So at HealthAI, when we think of AI governance, we like to use the analogy of building a house. Many of you who have built your own houses before, you know that before you start actually building, you need your architectural blueprints, right? And this is where your national AI strategies, your policy orientation comes in. Once you have the blueprints laid out, basically you need the foundation to start building up the walls. And this is where ethical principles, frameworks come in, really the core values, your societal values that govern how AI should operate. So that's your solid foundation for the house. Now, once you have the foundation, you need to start building the walls. And this is where we say horizontal legislation will come in. When I mention horizontal legislation, what I'm referring to are things like national AI bills, the EU AI Act. And of course, with a house, you can't have it just, four walls. You need to have the windows to make sense, to let the light in. And this is where your health sector regulations come in to guide the applications for the AI applications in health further along towards market access. And then finally, to make the house truly operational, you need to have a roof, right? Otherwise, the rain and the water will get in. And that's where international standards and the guidance really help us wrap it up and really operationalize the legislation and put it into practice. So in reality, AI governance range from AI national strategies, data governance, medical device regulation, health technology assessments, all the way to liability and litigation policies, cybersecurity policies, consumer protection laws, and many more. And what is important for us to note is that although we often hear that AI is advancing faster than governance capacity, healthcare is a regulated domain, and this is no question, right? And the do no harm principle holds. So if you look at how we have been regulating medicines, vaccines, medical devices, there will be no exception to AI applications in health. And at the moment, the regulation of software as a medical device by default includes AI as a medical device. Now, even for products that are not regulated under medical device regulations, there are international standards and guidance to ensure their responsible development and deployment. We strongly believe that when the right safeguards, oversight, and regulatory clarity is not in place, adoption stalls. And on this point, I would like to share an interesting exchange we have had with the Ministry of Health in Zambia recently. So for context, Zambia is actually part of our global regulatory network. This is a network of countries that we're working very closely with to strengthen their capacity to govern AI applications in health. We currently have 9 countries across the world, and we are continuing to expand the network. So Zambia is coming to us indicating that the MOH is actually really overwhelmed, especially the past few months, by the number of vendors coming to them proposing to pilot their AI products with them. Now, the ultimate question that is holding them back is who can they trust? With all of these vendors coming at them, who can they trust? Because they know that on one hand, there is a lot of great potential, right? That people talk about, that AI can truly transform and address the needs of their patients, their healthcare systems. But on the other hand, they also clearly realize that they need the right governance, market authorization processes in place before they can start using these products and letting the citizens benefit, right? So by being part of our network, they are actually able to consult with other governments facing similar issues or have solved already similar problems. We are also working with them through technical assistance, training, to make sure that they can adopt a risk-based approach in their assessment of the AI tools, be able to ask for and also assess the right evidence that's actually produced from data representative of the local population. And then eventually in the long run, have some form of post-market surveillance mechanisms. And now then to your next question, Daniel, is where do we see the biggest gaps today, right, in AI governance? And this is really something that I want to highlight that, and most of you will know, given that I believe every one of you has worked in this industry for a while now. In healthcare, strong governance has always been grounded in clinical evidence and evaluation, right? What we're observing today for AI is that on one hand, we are facing more and more adaptive systems that are often producing outputs that are very dynamic and therefore also very difficult to be reproduced, right? But on the other hand, a lot of our existing evaluation methodologies are meant for static products and not for adaptive systems that evolve over time. And I can share more later how some countries are actually tackling the adaptive nature and what they are doing in response to this. The other gap that I want to highlight is really that what we're noticing is that unlike medicines and vaccines, AI governance or AI applications in health is no longer just under the purview of the Ministry of Health or any one authority. What we are seeing is a multi-layered governance architecture that is really cutting across different ministries and departments, and therefore cross-institutional coordination is really critical. But what we are observing on the ground is that in reality, this can be really challenging to achieve. So I'll pause there and hand it over to you, Daniel. Thank you.
All right, I have to say I really like that example of the house. And I'm going to use this from now on, so this is great. Also remind me, you mentioned the World Health Assembly. It was like 2 or 3 years ago that Theodros said like the future of health is digital. And I was thinking about like, yeah, look where we are now. And let's make sure we have a strong governance framework. So thank you, Penny. That was, and I think we have some questions for you coming up later, but I want to move over to Matilda, and you were sort of building on that and the Your work, Matilda, has focused heavily on data governance and country ownership, and this particular important moment now, where we are heading into the World Health Assembly that I just mentioned, and where we are still falling short between commitments and implementation. What feels most urgent right now? So I know it's a broad question, but leave it
Yeah,
there for you.
thank you so much, and thanks for the opportunity to speak here today. I think I have some slides. I don't know if we can bring those up. Thank you. And we can go to the first slide. So I just wanted to give a brief overview. Transform Health is a global coalition of more than 200 organizations united by a common purpose, which is health for all in the digital age. And we bring together governments, civil society, young people, and other stakeholders to strengthen the enabling environment to ensure that digital health works for everyone, not just the privileged few. And I would like to start by saying that digital transformation, we believe, is not really a technical issue. The technology is there, it works. But what we really need to see is the politics. That's where we're lacking. So without the right political commitment, without the right systems in place, we won't be able to achieve the transformation that we all would like to see. So what you see here on the slides is just a snapshot. There are a number of commitments at the moment, including the WHO guidance on ethics and governance of AI for health. Pei-Ling mentioned a few. There's also the African Union's AI strategy, the OECD AI principles, etc., EU AI Act, and the list goes on. We also launched the Health Data Governance Principles in 2022 that have been endorsed by more than 170 organizations and governments worldwide. But where we're still falling short is in turning these principles into enforceable frameworks, and at the country level in particular. Too often, commitments remain high level, voluntary, and really quite fragmented. In practice, this means that as countries roll out digital health tools and AI systems, the guardrails on data ownership, privacy, accountability, and equity are still really uneven or really missing entirely. And that's really the implementation gap. So what we need is common standards. This is what we really believe at Transform Health. Common standards really matter because AI governance in health only works when systems can interoperate safely and when there is a shared baseline for privacy, accountability, and responsible data sharing. Without that, countries face a race to the bottom, including fragmented rules, weak enforcement, and greater risk of data extraction or misuse, especially where commercial interests move faster than public safeguards. But I also want to emphasize that a common framework does not replace national action. It gives countries a reference point that they can adapt into accountable domestic laws and policies that reflect local priorities and values. So this isn't just a governance issue, it's also a power issue. Standards are what makes collaboration, accountability, innovation possible, but within and across countries and institutions, both within countries and institutions. So we can go to the next slide. And just to, and I think I just spoke to this, next slide, please. So here you can see the work that, next slide. Yeah, there we go. That Transform Health has been doing and driving with partners nationally, regionally, and globally over the last few years. It is our belief that good AI governance starts with good data governance. AI is only as trustworthy as the data and governance systems that underpin it. And those systems must be anchored in national decision-making. National governments and citizens must be able to control and benefit from their own health data if AI is to benefit the public. So taking an example from some of our work, the African Continental Framework on Health Data Governance is currently being developed by AU countries, member states, under the leadership of the Africa CDC, with technical support from Transform Health. And this establishes regionally aligned agreements on ethics, sovereignty, equity, and provides countries with a framework to translate these agreements into national law. And that kind of regional framework creates the common standards that I was speaking about, while national adoptions turns them into enforceable rules, institutional practices, and public accountability. And this is something that we are working towards over the next few years. So I also wanted to address the elephant in the room, which is the World Health Assembly. So we're heading into the World Health Assembly in a bit more than a week. The signals that matter most are whether member states will move from rhetoric into action. What matters most now is concrete decisions on frameworks, legislation, resourcing, and technical support that help countries build accountable national systems. If the World Health Assembly sends a clear signal that health data governance is a foundational part of responsible AI in health, it will really help shift the field from aspiration to implementation. And the good news is that governance of digital health data, of digital health data and AI is on the agenda of the WHO. But it's now up to us and our governments to really make it happen. So I think, we're at a very critical point. The main risk of delay is that AI in health becomes more fragmented, more extractive, and the less accountable systems, with countries relying on imported tools and external data practices that do not reflect local rights, needs, and oversight. And that's why we should reaffirm common principles and embed them into accountable national frameworks that really strengthen health data governance and make human-centered AI possible really in practice. I'll leave it there. Thank you.
Wow. Thank you, Matilda. And I just had to think back about that. Does everyone remember that map from Uganda from back in 2011 with so many digital systems, all little pilots? And at some stage they said, oh no, we have to stop this. We have to concentrate on standards and governance and the national frameworks, as you said, and governance is such an important part of that. So thank you for going to the details there. And I think we have more questions about this coming up later. So thank you, Matilda. And I want to move over to Pedro now. So Pedro, your work takes this one step further, and you're looking to what actually sort of needs to be in place for AI to work in practice. And you have argued that AI readiness is really system readiness. And can you bring that sort of to life in maybe a couple of examples for the audience?
Thank you, Daniel. Thank you, Sarah, and the Bay Area Global Health Alliance for the invitation. And thank you, Pei Ling and Matilda, for your great interventions. Indeed, at Vital Strategies, we believe that if governance is the bottleneck and country ownership and sovereignty over its data is the principle, then we have a very practical question to answer here. What does a public health system actually need to have in place to have AI that is safe, useful, durable, and therefore properly governed? And to address this, we have developed a report. The final version is going to soon be launched during WHA on the 19th. But previous versions for comments were published in December last year, in February this year, and in which we interviewed over 24 of public health and AI experts throughout the world, investigated foundational readiness data around of 83 countries of the Global South, and mapped a landscape of over 250 AI applications on the Global South. And our conclusion is out of this report is very in the lines that you brought about here. AI readiness is system readiness. AI cannot compensate for weak public health systems. It can only build on what is already institutionally, digitally, and politically in place. And we're talking here about two layers of foundations. Inside the public health system, we're talking about foundational data systems that are institutional, digitized, interoperable, publicly ownership and governance of those systems, human and institutional capacity to use and steward AI, and financing that treats data and digital systems as long-term public infrastructure, not time-bound projects. And across the wider national ecosystem, and I think this talks to what Pei Ling was bringing about here. This is not only one layer of governance, but this is also not one layer of foundational infrastructure. We we see that there is a need for digital, wider, beyond public health, digital public infrastructure, legal and regulatory and trust architectures that are in line with standards, as mentioned by Matilde, and cross-sector coordination that allows intelligence to actually translate into action in public health. So just a few examples here. Out of the 83 countries that we scanned for readiness, sorry, roughly 1/3 of them have adopted a national AI policy. This is a very recent movement, so it's decent. There is quite a lot of heterogeneity in these policies as well. Some are very well thought of and very well designed. Some are just a pro forma policy. But what we see is that policy ambition is outpacing implementation capacity. So connectivity is uneven, interoperability is partial or inexistent in most settings, core health data is incomplete, and so on and so forth. So let me just give one example of when these foundations are in place, what is the future of public health applications of AI. In Recife, in Brazil, we had the privilege of working with the Department of Health, and building on its existing record of continuous electronic medical records and other data health systems already being digitized, organized, and available for the Department of Health, we were able to integrate these data sets from electronic medical record to hospitalization to mandatory notifications to death registries and create patterns of life of patients. And we created a semantic-enabled or AI-enabled applications to augment the capacity of primary healthcare units by alerting professionals of potential risks. We started this with gender-based violence or domestic violence. We were able to identify that 80% of violence against women and children and girls was being under-detected in primary healthcare environment. Around 13% of all women who use the public health system in Recife in 2022 had signs of domestic violence, and just a small percentage of those women, less than 20% of those women, were being seen, captured, and referred to properly care by the system. Not only gender-based violence, but suicidal ideation and attempts, we can detect with this type of integration and this foundational use of AI, we can detect suicide ideation around 6 months prior to attempts. And therefore, we can alert health professionals to provide more comprehensive care. I would like to add one thing to this example, which is the shiny application, the demo, the dashboard that usually involves the decision maker. It relies on a solid foundation. It relies on a solid governance on how to use data, and it relies even on the legal ability to use the data. Because this work that we did in Recife, we tried to do this in another city before Recife, which I will not mention because you understand, and they wanted to do this, but at the end of the day, they figured out that their contract with their IT provider didn't allow them to access freely the open text field of electronic medical records. So they had a provider for over 15 years for electronic medical records, and they could not legally use without extra pay their own public sector owned data, because they had to pay for per extraction. It would make the system financially unsustainable. So this is how I think that this topic of foundational and capability readiness talks to the topic of governance, because when you have this type of fragmentation or weakness in capacity, you are unable to advance to the future of what AI can provide to public health. So I'll stop here and leave it for the comments.
That was a fascinating example, Pedro. Thank you so much. So I can say that here at FHI 360, when we did the first policies, and now I have to redo them again. And the legal department is one of the busiest ones, so to look into all the different country regulations, it differs so much. And that was a perfect example. So so what I gather is like governance isn't a side issue. It's a gating factor, and it's showing up in in data control, system readiness, and country ownership. So I would like to turn to some follow-up questions that we had received already when we sort of started the session, and there's some more have come up in the chat as well. But I want to start with you, Pei-Ling. And so when you look across countries that are starting to get this right, what are the one or two governance elements that actually made the difference? And what is in place where governance should be shaping decisions, but often it isn't. So if that's okay, if I can refer over to you, Pei-Ling, on
Yes.
that one.
Thanks a lot, Daniel. So if you remember what I mentioned, those two gaps, right? So one of the first gaps I talk about is we have static we have methodologies that are meant for static products like drugs, like vaccines. But on the one hand, we have adaptive systems, right? So what we're seeing in a lot of countries now, more and more so, that they are adopting what we call innovative regulatory approaches. So regulatory sandboxes is one of such approach, right? Where you are able to convene multi-stakeholders in a very controlled environment to contribute to the development, the training, the testing, the validation of emerging technologies with limited regulatory constraint. When you do it in such a way, it allows for you to get a sense of how compliance with regulation and ethical frameworks would work in practice. And the other approach would be some countries are using model cards, nutrition fact style labels for AI as a medical device to increase transparency, to reduce the black box problem. Some countries are also using what they call predetermined change control plans or change management control plans to allow certain algorithmic modifications post market approval, right? So these are some of the approaches, and I think we need more and more of these to really deal with the generative systems that we're seeing, the agentic systems that are also slowly showing up. So that's one element. The other element where countries get it right is that they start to invest in what we call an effective post-market surveillance systems, right? And really expand the authority so that it's not just pre-market authorization, but it's really expanded authority for the total product lifecycle monitoring. So they make sure that there is mandatory reporting of real-world change performance, effective incident response mechanisms. So how do you detect AI failures? How do you respond to them to put them in place, including retrack systems, right? So at the national level, definitely we need an effective post-market surveillance system. At HealthAI, what we try and do is within our global regulatory network, we try to work across with the 9 countries that we have to build what we call a global early warning system for AI adverse events that will potentially take place. And this is something that we are very excited and we want to hopefully build it in the upcoming months. So that's kind of where, post-market surveillance mechanism need to be in place. The other element when it comes to governance, and this is because, AI as it becomes more and more autonomous, more and more agentic, the liability is a big issue, right? Like who is accountable when AI fails? So we are already seeing advanced countries paying more attention, providing more guidelines to liability considerations. So for example, Singapore recently in March released a new version of their AI in healthcare guidelines, where they gave quite a bit of attention to the roles and responsibilities of each stakeholder, be it a developer or a deployer or a user, across the AI total product lifecycle. So these are some of the elements that we see that are emerging and that are quite essential for the governance of AI applications in health. To your sort of second part of the question, where you asked about where governance should play a more important role in decision making, and this is really one area I think governance should play a stronger role, and that's in when it comes to tool selection for funding or for selection of pilots for scaling, right? Because and I think you mentioned that, Daniel, about pilots, right? There is a tendency for innovators and researchers to think about market authorization requirements only at a later stage. They are always excited with this shiny tool. They start with a pilot, but also oftentimes end up in a condition of what I like to call pilotitis. So I believe that if they start getting the regulatory strategy right in the first place, consider it right at the beginning, we can actually really encourage scaling and quicker adoption down the road. So in the same way, when funders select a tool for funding and scaling, I think there should be more considerations to whether the tool has actually incorporated the right ethical principles, the right governance frameworks, as well as also have followed international standards. And that should really be kind of the driving force, right? Because, Pedro, I use this shiny tools that came from Pedro, right? Because I think oftentimes the issue here is that a lot of investment is going into shiny tools, but not so much, the Ferraris and the Lamborghinis, but not so much the highways, the roads for these shiny cars to drive on. And I think that's really critical for us to invest in those ecosystems as well. Thanks.
Thank you, Pei-Ling. There was so much in there. So wow. So first of all, the pilotitis was the scale. Anything like governance is not here to, it's actually here to make it a success. Yeah. So so your small pilot, if you get the governance right, we help you to make that as sustainable and grow. And you mentioned something else that I think we haven't spoken about much: funding. If you get your governance right, it's actually an important part of for fundraising. So excellent points from you. Thank you so much. And Matilda, I had a question for you come up, and you would at Transform Health, you work a lot at the national level of national governments and standards and so forth. So, and the country ownerships are clearly rising, but in practice that can be complex. So, what does doing this well actually look like today, especially when governments are engaging with donors, multilaterals, and the private sector partners?
Yeah, I think I would say that we are seeing a lot more appetite from governments, particularly around updating national health data governance frameworks to ensure data national sovereignty around data is and especially around sensitive data is in place. So I would say there's been a lot more kind of emphasis, especially in recent months, with new bilateral agreements coming into play and stuff like that. Some of these agendas have really risen to the top. So there's definitely a lot more kind of political momentum. There's also a recognition that some of the frameworks that I was speaking about before cannot really be solved at the global level at the moment, or will take a really long time, because the multilateral system is somewhat broken, and therefore a lot of regions are turning to their regional bodies to develop cross-border data sharing agreements, etc., that are context specific and taking really the needs of the regions into consideration. I think coordinated action is needed now more than ever. I think this, we always talk about coordinated action, and actually implementing that in practice is no easy feat, right? I think at Transform Health, we launched the roadmap to 2030 to work collectively with our 230 coalition partners and others to ensure that we address the enabling environment in digital health and work towards our common goals around universal health coverage. And we are working we're kind of mapping this out at the moment through national action plans that will focus on 5 priority goals that we set out in the roadmap around data, AI governance, regulation, legislation, investment, etc. And so we hope that this that by working more in these kind of collective manner, that and moving from strategy and action to actual implementation, that we will also help funders, governments, and the private sector to fund, coordinate, and really drive digital transformation more sustainably, effectively, and at scale. But I also think one, and I really agree with what Pei Ling said about around funding. I think, while we are seeing, tremendous progress at the moment and appetite for some of these governance agendas, we also need to consider how these are then translated into national budgets. Countries really need to update their budgets to include these new aspects of the digital health enabling environment, and to ensure that we address these kind of governance and systems level changes that need to happen, and that budgets and financial mechanisms are really updated to align with the needs in the digital age.
Thank you, Matilda. And the roadmap you were referring to is in the chat. And by the way, have a look, everyone, at the chat. There's interesting materials there. There's also the report that Pedro mentioned earlier on. And I have to say, some of the chat comments are like, it's a very lively chat, so I really appreciate that. But there was another question for you, Pedro, and you just mentioned that quite fascinating example of the medical records where you sort of answered, oh, I don't have access to that, and so forth. We've talked about this AI readiness as system readiness, and when those foundations are not in place, what are the most common points of failure that you're seeing, and what should organizations do differently to avoid them? If I can take that over to you as
Thank you.
tricky.
Thank you. And this is very much in line with the answers that preceded this question. The initial thing that you see when the foundations are not in place is the phenomenon of pilotitis. Because if you don't have true infrastructure and institutional infrastructure to allow for adoption and absorption of sophisticated tools for public health, the tools are going to work in demonstration settings. They're going to work in very circumscribed environments, but they're not going to work in an integrated, sustainable, and scalable manner. And this talks to this fragmentation talks to another very complicated and problematic issue, which is fragmentation is not only bad for the system, but it also aggravates the inequities in the health system that we've seen, because usually pilots are going to be deployed in areas that are better served and better funded and have a better infrastructure. And we're going to leave those that are already behind even further on behind. Another thing that we've mapped in our report that is quite and so for those that are going to be behind, they're going to be less visible and with less access to health. But one final thing that I'd like to highlight on problems before talking about solutions is vendor lock-in and loss of sovereignty. Because as with my other city example illustrates, when you don't have these foundations, these capabilities within workforce, this technical ability to embed digital tools in public health and so on, you end up giving away your sovereignty over your data, over your decisions down the road to vendors who come with a shiny solution and convince you that this is the way to go. So what we are seeing and what we are actually advocating for is that the most useful investments in AI for public health over the next decade may not be investments that look like AI at all. They will be investments in interoperable data architecture. They're going to be investments in civil registrations and vital statistics. They're going to be investments in primary care digitization, workforce capability, and long-term domestic financing for healthcare. So this is what we're advocating for, and showcasing that this is a very important opportunity, even for market shaping. If companies and if the ecosystem wants the public health sector to adopt AI, the foundations need to be there for this to be actually absorbed.
Wow, thank you, Pedro. That was yeah, it's fascinating to AI is an enabler, yeah, and still it might be a lot of other things that it drives and vice versa. So yeah, thanks for that. And I have a question for like everyone, and I start with an example here. So and I was at this Microsoft conference there, and it was very much look at the corporate side of using AI. But there was this one quote that I actually put on LinkedIn because I found it fascinating, where they were asked a question like, if you're working like with this AI at the moment, is one thing. What is the main thing you should ask? And there was, I think it was from, I don't know for who it actually said, but it stuck with me. Like he said, don't start with AI, start with the problem and then go to AI. And it just stuck with me. And so I thought that was great. And that's a question I kind of want to ask to everyone a little bit here. Like if there is, if you're evaluating at the moment an AI tool or partner or strategies, let's say for the next 12 months, what is that one question they should always ask? I've given one already, so but there are more. So who wants to take that? So what is the one question you
I
would
think the one question is, who is it serving, and who is it benefiting?
so
All right.
like the old question, what is actually the problem you want to solve? Yeah. But you said who is it serving as well? Yeah. So go,
Y-
go ahead, Penning.
Yeah, Matteo, I thought you would talk about data, but I actually wanted to, then I'm going to talk about data because I think oftentimes, AI tools can be flowing. I mean, not just north to south, south to south, and I think it's very important that I think ultimately that one question is, first of all, to see where the data that is training this AI system is coming from, right? Is it coming from your local population? Is it coming from the population that you're intending to serve? And I think that's actually a very critical question. And of course, from there on, you have to look at other things like effectiveness and things like that. But I think the data is really the key.
And one small addition to this, Daniel, is whose data is this AI learning from, or whose data is this AI using to create solutions for? But also, who is invisible to it, who is not being seen by? What are the weaknesses in foundations and systems? Who is being left behind because of of these weaknesses, and who is not being seen, and therefore having their health even further harmed.
I think that's an excellent point, Pedro, as well. So that digital divide that we're talking about since a long time, that's being amplified here. Yeah. So those who have access to it or not. So, which again means that we need to have good governance in place to make sure that we get this right. That was fast. I think we're slightly over time, Sarah, and I don't know if you want to take on some of the questions that came from the audience. I think there were a few. Is that okay if I hand over to you? I can't see all of them here.
Yeah, thank you so much, Daniel, and thank you so much to our amazing speakers. Before we move on to audience questions, and we've had some really, really good ones, but we have a little bit more time. I do think it might be interesting to ask you all, or one question that I have is, what are you seeing as the most important tensions right now between speed and oversight and innovation and control and global scale and country ownership? And how are organizations navigating those trade-offs in practice? And if you could kind of give more of a concrete example, if you have one. I ask all the panelists, but if one or two of you just have an answer to this. And then I have one rapid fire question to ask you after that, and then we'll move into audience questions.
Maybe I can go first because Sarah, your question actually reminded me of a report that we're actually launching at the World Health Assembly that's looking at the EU AI Act, its implementation challenges, and how SMEs are actually navigating the space, right? And it's actually a really interesting use case when it comes to the European Union, because you see that they are putting out an AI Act that really, give that sort of regulatory assurance for a single market. But then at the same time, they have other economic competitive strategies, right? Like the AI Continent Action Plan. And then you have different like the European Health data space, the Data Union Strategy. So in a way, it's really kind of, a bit of a shifting sense kind of environment. And that's where I really see the tension, right? You do need that sort of single market authority, but at the same time, you want it to be kind of to remain competitive. And I think this is really a struggle that big regions like Europe is facing. And I think for the manufacturers, the vendors, it becomes a challenge for them to actually navigate this space, because in addition to sort of broad horizontal legislation, they have to also deal with sectoral medical device regulation, and we are really seeing a bottleneck there. Because in Europe, they rely a lot on conformity assessments, so have notified bodies to do the assessments for them, for the regulators. And notified bodies are not, they might register for the medical device regulations, but not necessary for the EU AI Act, right? So that kind of, so it's not even just at the policy level, but just implementing it. And I think someone said in the chat, implementation is really the challenge here. How do you put all of these governance policy into practice? And that's where I think tensions really arise.
Thank you so much. Anybody else? Pedro, Matilda, want to tackle that?
I would just add to that. I 100% agree with what Pei Ling said about implementation. I think also there's this tension that we are seeing. I used to live in San Francisco. Now I've moved to Europe, but I often heard that, we shouldn't overregulate. We shouldn't, put too much of this legislation in place. It becomes a blocker to innovation. I think we need to change that narrative. Governance is an enabler to address the system changes that are needed to create innovation and to address the gaps that we are seeing in the digital health enabling environment, particularly, I would say, in low and middle income countries. So I think we really need to, put the emphasis back at the need for governance and not see it as a blocker.
If I may, Sarah, I'd just like to reinforce this point from Matilda. It is a traditional tension in the debate about innovation, the discussion about governance versus innovation. But the bottleneck in the Global South isn't too much governance. It is very little infrastructure, actually, very little capability to deliver what is needed. So I think that speed without the foundations in place reinforces fragilities of the system. And however, sovereignty over data without the infrastructure and without learning in cooperation from South-South cooperation and other types of cooperation is also isolation. So we kind of have to do both. We kind of have to govern and move fast.
Thank you so much.
Sarah, can I add one other point? Because I was thinking about what Matilda said about coordination, right? And Matilda, you were talking about more international coordination and preventing fragmentation across the globe.
National
What we're
as well.
seeing, yeah, exactly. What we're seeing when we enter the countries to do the work, what we're seeing is also national coordination is a huge issue as well, right? Because of the fact that AI cuts across different ministries. Like oftentimes when we do our first implementation workshops with the country, believe it or not, this is the first time the different ministries are sitting together in the same room for 2 days talking about AI in health. And that's pretty amazing, right? If you think about it. So I really think, coordination is a really important, but it's in reality very difficult to achieve. And this is really something that we need to work on.
Wonderful. Thank you so much. And I just wanted to kind of end the session of the moderated questions, and then we'll go to Q&A with a rapid fire response from all of you. and I've loved how you've given really some practical guidance as well. But if we look at the next 12 to 18 months or so, what's the one practical shift that would most improve how AI is governed in health systems? And some of your remarks, I can probably guess what you would say, but we would love to have you answer that question, please.
I can go first. So I think we really need to continue to advocate and influence, both at the national, regional, and global level, that these governance frameworks are prioritized and are put into action and actually being implemented. At Transform Health, we kind of have four main asks to governments, but also to really all of us as stakeholders that are working in this space. So we call on, first of all, that there should be a World Health Assembly resolution on health data governance to be endorsed in May of 2027. And as I mentioned before, this year it's on the agenda. We really need to make sure that it stays on the agenda and that there is, a kind of concrete resolution that gets put in place, developed and put in place by next year. The other thing I would say, the other call to action is that we need to continue to strengthen national health data legislation and regulation to really protect privacy and human rights and mitigate risks. So some of this we've been speaking to here today, to ensure that health data and AI really serves public benefit. And then I think core to that is to ensure that we have rights-based principles and inclusive processes. And this comes back to this whole coordination, right? That inclusivity is the foundation of national, regional, and global frameworks, governance frameworks. And we need to ensure that we have meaningful engagement of civil society and the people that are affected by these changes that we need to see. And then fourthly, we need to establish concrete reporting and accountability mechanisms to really track progress and ensure that these commitments that we are seeing at these different levels, whether it's at the country level or through some of these more multilateral frameworks, are being implemented and that they're being reported on. And I think we have an opportunity as well through the next global strategy on digital health that is also now in process of being developed to ensure that we have very concrete reporting and accountability mechanisms put in place. I'll leave it there. Thank you.
Thank you so much.
If I may as well, Sarah. So my initial reaction would be to reinforce what I've been saying all the time here. Invest in the foundations, in digitizing systems, and so on. But I would like to give an example on how this could be done with respect to governance. You can make procurement a governance instrument. So use procurement terms of the contract to require interoperability, auditability, exit rights, local data residency, and other rights that can retain leverage in the country over the evolution of the model. So I think this is a very actionable point.
Thank you so much.
So I would like to go back to how I started with the house. I want to say that policies alone is not enough because those are just the blueprints, right? When you need to really build up the house, and the countries need implementation capacity. They need the right capacity, the right knowledge to be able to put out, regulatory pathways, health technology assessment pathways for proper pricing and reimbursement. All of these stuff needs to be taken into account. So I'm seeing a lot of a surge of policies out there, national strategies and everything. And I think that's a great sign. But I think we also have to hasten our pace in translating these policies into actual actions. Thank you.
Thank you so much. That was amazing. And I would like to shift over to some of the audience Q&A. And, for those of you in the audience, feel free to put a few more questions. We'll have a few. Thank you for those who've already put them in, and we'll have a little bit of time for a few more, I think. The one question that was I found really interesting that was coming up was Shadi from the IOM in Tunisia. And she basically said, if you're looking at an environment or places where digitation, sorry, it's early my time, it didn't quite work and they had a lot of challenges before. They were asking, can those places really catch up directly with AI solutions? And or is fulfilling that step of digitization, which, we kind of talked about a lot about the infrastructure, is that absolutely crucial before really benefiting from AI? So does anybody want to tackle that question? I found it really fascinating.
If I understand this correctly, is it possible to bridge the gap of digitization of health systems with solutions? I think this is a very good opportunity, and actually, this is a very good strategic opportunity for countries who are lagging behind to frame their policies around AI on as policies that require foundational investments for market shaping for future AI and market shaping in a sovereign way. But yes, it is possible. You can see very simple examples of today of digitization of paper systems that was unthinkable before, like being done with very little investment and then leapfrogging from very traditional systems to top-notch systems. An amazing example is from Rwanda, which invested over, it wasn't a small investment, but it was a dedicated investment in digital public infrastructure that started in 2016, and it allowed for a broad array of citizenship access to services based on civil registration and vital statistics and in a very integrated digitized system. So up until 2016, they didn't have this type of digital national identity. And then they have this digital national identity. They have digital systems for mortality. They can do electronic medical records. They can do a bunch of stuff that they couldn't do before. And it's a transformation in a decade in citizenship and in rights.
Thank you so much. Matilda or Pei-Ling, do you want to add anything more to that question?
Yeah, maybe just to build on what Pedro said, right? I really agree with what you said about, building their policies for AI, right? Even for countries with low resources, because oftentimes I think governance is almost seen as like a next step after innovation and as like a luxury item almost. And then this is really not the case, as we have previously pointed out. Governance is an enabler. Because if you really look at now how medicines are progressing, right? Like all of the manufacturing capacities, all of the innovation, the research are really at places where there's clear regulations, there's clear guidelines. And I really think this history, like this lesson to be learned from history, right? That we should really make sure that going forward, a lot of the let's say low and middle income countries are actually also investing in their regulatory and governance ecosystem for AI solutions, so that they don't miss out again when innovators look for places to invest and build their innovations, right? Yeah.
Great.
I would just maybe add that I think while we are all agreeing that we need to invest in the foundations, I think the funding landscape needs to catch up a bit. I think they're still investing in pilots and solutions. So I would just encourage, if we have any donors on this call today, to really look into, the systems strengthening that is so fundamental if we are really to see this kind of sustainable, transformation that we are talking about.
And Sarah, if I may, just one an addition based on Matilda's point. Uh, Not only sometimes the funding is going only to applications and to the shiny object, but it is assuming uh, a bunch of things that need to be proven. I've seen multiple funding streams in Brazil, even by the government, that are assuming that the type of application that they want to fund is going to be effective, is going to be cost efficient, is going to be secure, is going to be an ethical use of data. And there's a bunch of governance around this funding of the shiny object as well that needs to be worked on.
Thank you so much. And that kind of relates to another question that was in the chat, and which is, that one person was talking about that evaluation framework for adaptive set systems, and they mentioned you, Pei-Ling. And the question is, how do we go about evaluating AI in healthcare? Safety, reliability, and continuous learning and improvement, and the implementation gap. What will we need to address? How do we address this? Is one thing. There's the question in the chat.
Yeah, and I think we need to break this down into using a life cycle approach, right? So at every stage of the development, there are many questions to look at. So for example, at the planning stage and the formation stage, you need to clearly see what the problem is. Did the developer actually look at the problem first or look at the technology first, right? And then that is one critical thing. And then you come to the data collection stage, and this is a lot of what Mathilde said. Is the right data collected? How's the ownership, the consent taken, right? So all of that as well. And then you have the integration stage, deployment stage, right? Where you integrate it into a clinical actual workflow. How does that look like? Has that been tested? And are the healthcare professionals capable to adopt the solution, right? And then you have kind of like subsequent sort of post deployment stage where you have to continuously monitor the performance, whether there's a drift, whether there are changes in the way the AI is producing these outputs. So I wouldn't say that there's like one specific framework. I would say that it has to be a sort of in your toolbox, let's say, of tools that you have to go from sort of the start to the end. And it's a cyclic nature, right? Because of the adaptive nature of the system. It has to be each iterations, I believe, going forward. It's not like a drug where you just approve it and then that's it. It's out in the market. You just have, but it's almost going to be like continuously kind of in a cyclic manner being monitored and assessed.
Yeah, thank you so much. We had another question that came up in the registration that I thought was really interesting and kind of goes to a lot of our base at the Alliance, which are people who are in the startup and entrepreneurs and kind of looking there. And I think and Pedro, what you said about procurement and kind of being able to kind of put your not your wish list, but what your demands are in that procurement stuff. This person asked, how can local startups in health technology secure partnership opportunities to scale their impact in global health system strengthening? I'm not sure if any of you have an answer to that, but I think that is a really important question.
It is indeed. I can try answering that as well, but I would say that a competitive advantage for local startups or small startups is that they do it right, that they offer a product that is sound, but is also ethically designed in a way in accordance to proper governance standards. And I think this is a very good differentiator. The case that I mentioned here in Brazil was just outrageous. The city figured that out years after being in a contract with a provider and having not had the need to use at scale the type of unstructured data that at a later point, at a later stage, they needed. They didn't even figure out that it was a completely unethical or maybe even illegal contract. But if you're offering is an offering that is sound and ethical, then you have a competitive advantage in face of many other players in the market. But I'm not an expert on how startups should thrive, so I'll hand it over to my colleagues.
Yeah, I would add, I mean, I think it comes back to this coordination issue that I mentioned before. I think, if there are national coordination or convenings that bring together different stakeholders from different sectors to work on some of these bigger problems more collectively, I would really encourage you to join those. And if they're not in place, I would encourage you to advocate for them, right? For these coordination mechanisms to be put in place, because donors and governments, while they're saying the system is fragmented, we need more coordination. They also need to enable those coordination platforms and opportunities. So that will be my recommendation.
Well, thank you so much for that. And that coordination piece is really interesting. About a year ago, the Alliance was fortunate to be part of a roundtable with some philanthropic funders of AI. And what was interesting is how they all collectively could see the need for greater coordination on the funder level, both with, how we're evaluating AI to how you come together to make sure that the gaps are filled and that their strategic investments make the most impact. So I'll just add that was a really interesting roundtable. I think that this question is fairly similar, but just kind of widening it from what you said about startups is just for those in the private sector, tech, pharma, data-driven organization, what does that responsible engagement look like in practice when working with governments on AI and health? You gave a lot when you talked about startups, but is there anything else that you would like to add? Gearing towards the private sector.
Kelly, please.
Yeah,
I
please.
I mean, we have a community of practice in HealthAI, and one of the working groups that we have recently set up a few months back is really looking at participatory approaches to AI development, to AI governance, right? And I think, of course, I mean, this is a very sort of academic topic when you think about, citizen science, participatory approaches. But I really hope to see one day more of these sort of approaches being adopted by the private sector, because this is really critical. This is where you build trust, right? You build trust with the citizens, you build trust with the patients, and these kind of engagement will actually also, give a plus point, let's say, when you engage with ministries of health, with other governments, right? Because you have already started engaging with their citizens on your product. So I think that trust component is very important. And this is oftentimes overlooked because private sectors tend to think in a way that, as long as I have like the highest sensitivity, specificity, then my product is amazing, right? Like the technical prowess is important, I think, but ultimately you need people to trust your product to use it. So I think that trust building is equally critical.
Thank you so much.
And part of this trust building relies on understanding that AI will help a lot of health issues that we face today, but will not fix broken systems by itself, and that there are limits and to your pilot, to your demo, to everything that you're developing, and there are multiple contexts where your product will need to operate in different ways. So acknowledging that, listening to what are the context specific needs because AI is not arriving on a blank canvas or anything like that. It's being implemented on systems that have histories, that have different institutional design. They are strong in one aspect and weak in another. So understanding this embeddedness of AI within health systems and within health, a vision of health in each place where it's being implemented, I think is a key differentiator. And it's a problem for scale. I understand this, but it's also a differentiator.
Mm-hmm. Well, wonderful. I wanted to thank everyone in the audience for their questions and their comments. There were some people that made semi questions, but they were really just like profound comments. And so I have everyone, if you want to take the chat and save it and kind of look at some of these comments that our audience made, they're really, really interesting. But before I close this out, I have one more I love rapid fire in case you haven't noticed, one more rapid fire question. And if we can answer it quickly from all of you is, what is the one thing that you hope everyone in this audience does differently coming out of this conversation?
Well, before you invest in the model, ask whether the system underneath it is the one that you will still want in 5 years from now or 10 years from now. If it's not, let's work on the system.
And I would say,
E-governance.
oh, go ahead. I would say, yeah, governance is not a blocker; it's an enabler. So let's shift that mindset.
I would say to really see governance as an enabler, as the highways that you need to build for the cars to drive on. Yeah, thank you.
Well, wonderful. This has been great. And I see that my co-moderator, Daniel, is off mute. And so, Daniel, did you have any final things you would like to say before I close this out?
No, I want to say the same about the chat. I have rarely seen such a lively chat. Really some great questions in there. So yeah, if you want to follow up with any of us, and we can guide you to the various resources, the speakers you've seen today and others. So yeah, thank you so much, everyone.
Great. And I just wanted to add my thanks to Daniel, my co-moderator, and to the expertise and all the amazing work that Pedro, Pei-Ling, and Matilda are doing on a daily basis in their organizations, and for so many people in the audience as well. If this is your first Bay Area Global Health Alliance convening, we invite you to kind of go and look on our website. We have we've been doing a series on AI and global health since 2023. And so I think you'll find other practical guidance that might be of interest to you and good insights. We have been recording this session. We'll have an insights report with some key takeaways on our website soon. But I just want to really, really thank everyone for participating in this AI and governance convening. I think it was really, really great, and I certainly learned so much. So thank you again, and we wish all of you a wonderful day, night, week, everything, and we'll see how things happen at the WHA in a week plus. So thank you again, everyone.